Hello, hello, hello. Hi. We dispensed with the voice of God. Um, I actually had my own one-on-one conversation with the Lord, and she said, next time we need a different voice. So that's all right. That's all right. So I want to thank all of you who are here. This, as you know, is our 20th anniversary, the 20th time we've been doing these health action conferences. And there's so many highlights that we can think of. You see some of them in the pictures that have been shown on and on. We've had Barack Obama here 3 times. Go ahead. Those are no doubt non-partisan applause. We've had Hillary here a couple of times. We had Bill Clinton here. We've had Paul Wellstone, which was a real thrill for so many of us. Ted Kennedy multiple times, on and on. But the thing I want to just say in the minute or two that I'm going to talk is that as significant as those have been and as memorable as they have been, I think the thing that we take away from these conferences is not so much these celebrity speakers who come to the conference, as enjoyable as it is to hear them. What is most significant for us is to be with you, for us to be together, because we inspire one another. And our staff works really, really, really hard to put on this conference. And of course, folks are a little tired at the end of the conference, but most significantly, they're energized, they're inspired, and that's what's so important. Which leads me to this awards celebration that we're doing. How many people who are here have been past recipients of awards? Could you stand? Well, the reason we do these awards of these wonderful people who have done excellent work is because it helps all of us. And the best way I can describe that is with a song, which I will not sing because I have, people on our staff have a bit of taste, and I'm not going to sing. But some of you may know the balladeer Sai Khan. Sai Khan has been a balladeer for a number of movements, and one of the songs that he composed really, I think, captures why this part of our conference is so significant. And the song that he wrote ends with the refrain, "People like you help people like me go on, go on." And that's why we're always so happy to do this celebration. Now, to carry us through that celebration, the person who inspired the thought of our doing this and who created Families USA, and probably doesn't need a lot of introduction, but please give him a good, warm round of applause, is Phil Villers.
Hi. There are a couple of events at our annual meeting that, for me at least, are very special, and I really enjoy them. The first one today was on your behalf. I went to thank our wait staff, members of Local 25, tell them why we're here. And this is the second event that I greatly cherish, because this is where we honor the heroes of our healthcare reform movement. And we've been doing it for many years and have honored many wonderful people who've played a role, a successful role, in bringing about the change that we collectively have already brought about and will bring about in the future. In fact, the theme of this year's conference of health system transformation is a beautiful theme. We'll be working on it for years, and I expect the same ultimate success as we had for Healthcare 1.0, otherwise known as the ACA. So let me get on with this year's celebration. It is always difficult to single out a particular part of the country and a particular organization and then a particular individual. But our staff does that and does that well, and so I have the honor of presenting health activist heroes from 2 states, and then for the first time, we are giving an award we call the Health Equity Award, showing that very important part of our movement, which of course is not just to provide health for the American people, but do it in an equitable manner, something which of course is an unfinished task and will be at it also for many years. So, the first award is going to involve Kentucky. And we're going to do it slightly differently this year. So I'd like to invite Erica and Regan to come here together. Erica will have the pleasure of telling us a little bit about the award.
Oh, they can't hear you.
Erica Binder-Wooten of the Foundation for Healthy Kentucky is the one who's going to tell us something about the awardee. Erica?
Thank you. Hello, good evening. It's my pleasure to introduce to you tonight, for those of you that don't know, Regan Hunt. She's a tremendous force in Kentucky, and we couldn't be more proud of her. Regan is the Executive Director of Kentucky Voices for Health. In this role, she leads a coalition of 250 organizations and individuals working to build a healthier Kentucky. Kentucky Voices for Health led the advocacy effort to successfully expand Medicaid in Kentucky in 2013, and has been one of the leading advocacy organizations and has been one of the leading advocacy organizations on outreach, education, and enrollment efforts in Kentucky. In her spare time, Ms. Hunt also finds time to volunteer. I'm not sure when that is. She's the Community Research and Data Chair for the Junior League of Louisville, a big sister for Big Brothers and Big Sisters, and is on the Associate Board for Gilda's Club. Prior to her time at Kentucky Voices for Health, Ms. Hunt spent more than a decade working in health policy, community building, and advocacy. Ms. Hunt has an undergraduate degree from Transylvania University and a master's degree in public health from the University of Kentucky. I think it's safe to say that Kentucky would not be where it is today without the tireless efforts of Regan and the coalition that she leads. Thank you, Regan.
Congratulations.
Thank you guys so much. This morning I was actually in a meeting with the folks from In the Loop trying to talk about this, and I get very humbled and I don't really know what to say and I start to blush, and I likened it to an Academy Award. So this is like the Academy Awards for policy wonks, you know? And so I feel like I should say thank you so much. But quite frankly, this is an honor that I have building a whole life around. So I can't do this without the folks that have helped me get to this point. So folks like Rich Seckel from Kentucky Equal Justice, who've been doing this for decades, and Ann Joseph, who's been doing this for covering Kentucky's kids and families for decades. These folks helped me understand the climate of Kentucky and the history of Kentucky as we started doing this advocacy that we're doing now. The folks in Kentucky, my Kentucky peeps, as I call them, the folks like Kara Stewart from Kentucky Equal Justice. Twitter at this event this year is not the same without Kara because she has magic thumbs, and so we miss her dearly, but she makes this work fun. Same goes for Lindsay Nelson, who works for the Kentucky Primary Care Association, who's our Get Covered Kentucky chair. She's the mastermind by all of the work that we do in terms of target population outreach, fact sheet works. I just get to spend money and tell them, here's money to do this work. So quite frankly, without them, we wouldn't be where we are now. And my national folks, my Southern Health Partners groups, I pick your brains all the time. I learn from you, even though we're a state that's expanded. Learning from you still every single day, keeps me on my toes. And finally, I want to thank my folks because they didn't realize they had they did realize they had an activist and an advocate on their hands at the age of 5. And so I did a, Milk for All campaign in kindergarten. Because the kids, not everyone got access to chocolate milk and strawberry milk. So I had to sit in, and then I did a Kickstarter campaign. So even though Kickstarter doesn't exist, but that's how I got started. And so my parents supported me. They let me ask the questions why and why not over and over and over again. I want to leave with what Senator Brown said today, because one of the last things he said today was make good trouble. And that sums up my entire life. And so I'm going to leave you guys with saying I'm not finished yet because I still have more good trouble to make. So thanks, guys.
Well, we have another distinguished award coming out of some very fine state work. In fact, the work in Maryland has become one of the important models of our movement. And for this, I'd like to invite Vinnie and Lenny to come up. And tonight, Vinnie DeMarco, who many of you know, a great many, who heads the Maryland Citizens Health Initiative. Thank you. Thanks for the help. And so he's going to tell us all about the awardee, and I will not steal his thunder.
Thank you, Phil. Thank you all very, very much. Maryland has been doing leading this nation, one of the leading states in the nation in getting people enrolled under the Affordable Care Act. Just today we learned that over 185,000 people enrolled in health care in Maryland since the second enrollment began on November 15th. Partly that's because we have great people running that, but largely it's because we have people like Lenny Preston and the Maryland Women's Healthcare Coalition who are out there making sure that our policymakers do the right thing. We know Lenny in Maryland as someone who, even though she's a volunteer, she goes to all those meetings. The meetings, whether it's at the Maryland Health Exchange or the Health Service Cost Review Commission or the legislature, and she's there looking at them and making sure that they do the right thing. And then her coalition does a great job of letting consumer advocates and all of us know what we need to know about what happened there and what we need to do, with links to effective tools and with ways that we can all be helpful. She's also worked very hard in the legislature to make sure that the laws that created our exchange are good and consumer friendly. created things like the Standing Advisory Committee that we both serve on, which is overseeing what these people do. It really, really is important and critical to the success of our success in Maryland, what Lenny and the Women's Coalition have been doing. Also, we are at the cutting edge in Maryland of health system transformation, and Lenny and I both chair task force to make sure consumers we reach consumers and we engage them in making this work right. And Lenny says something that we all need to know, that people need to know what to do with that card. So she works very hard on making sure that every Maryland is literate in what they do with their health care, which is very, very important. We know her in Maryland as charmingly pushy, but in a way that really works to get things done. So I'm honored to work with her and Lenny Preston. There you go. Let me congratulate you.
So anybody who knows me knows that I'm never speechless, but I'm close, but no such luck because I have a few things to say and a few people to thank. So I can't begin to tell you what this means to me and what it means to those who are working with me. So, and to, watching previous awardees like Dizzy and Dee Dee, who would ever have thought that I would be up here? But I saw Elizabeth Benjamin as she was leaving today, and it made me think about what Senator Brown said, because he said, to be a great advocate, you have to get in the way. Well, I watched Elizabeth once nearly knock down Secretary Sebelius in order to talk about BHP, right? You all know that. I mean, I will say that Secretary Sebelius did admire my shoes one time, so I was close, but not quite. So let me first thank Families USA. I have to tell you that whenever we have a question in Maryland, I am on the email immediately, and I am sure that the reaction at the other end is, oh my God, it is Lenny again. Who is going to answer it this time? But they always answer it, you all know, within minutes, and it's just what you need. So I thank you for that. I thank you for the award. I have to thank my family who came down, my daughters, Erica and Caroline from New York, who are really, they are the inspiration for what I do, and my husband, Ned, who keeps the home fires burning, stocks the refrigerator, walks the dog, does all those things, because I'm too busy driving around the city. So, and I recognize that this award is not for me. It is for the work that the Women's Coalition has done since 2006. We were birthed then, we have grown since, and almost every member of the steering committee is here. So I like to say they're going to kill me. I can hear Adrienne now. She's saying, oh my God, don't say that. I am the pretty face. They are the brain trust. So Lee Cobb, Adrienne Ellis, Mary Lou Fox, Deborah Hickman, Ellen Weber, Susan Wood. I have to read them so I won't forget anybody. We have an incredible consulting team. Wendy Frost, who's consulting with us, is here. Really, what we do is only possible because we have created a collaborative model that has brought the best minds in Maryland, including Vinnie's, to the table to make sure that consumers get what they deserve. So, and we couldn't do it without our national partners as well. I have to recognize Cindy Pearson and the National Women's Health Network. They're our fiscal sponsors. If you have a checkbook, feel free to write a check to the National Women's Health Network. She's right there. It's tax deductible. We'll take it. And Raising Women's Voices, we were one of the earliest regional coordinators. We could not do what we do without Lois Utley and Billy Avery and all of the great work that Raising Women's Voices has done. So Lynn Quincy, Consumers Union, Community Catalyst, the Center for Budget and Policy Priorities. I think Dave is still here, and I'm sorry I'm not wearing the tiara I promised to wear tonight, but it wasn't shiny enough. National Women's Health Center. All of you, every single person in this room is the heart and soul of what each of us do every day. And we thought Maryland was going to be in the lead on October 1st, 2013. And, we opened the door, we turned on the lights, and we went, oh, my God, what happened? And I would argue it's because they didn't listen to us, right? So we're really grateful that you invited us back for this. So You know, I used to work in the museum field, and my friends from that period say, what in the world do you think you are doing? I mean, you're retired, right? And you're driving all over the state, and you're learning this entire new language. I used to think that AMA stood for the American Museum Association. So when they asked me to join the coalition in 2006, I said, are you out of your mind? I know nothing about this. But I do this for all the obvious reasons. Senator Brown said it today, because we want to make a difference, right? This is our chance. This is my chance. But one of the reasons I'm here is actually one of those quirks of fate. So my husband and I moved from voiceless and voteless D.C. I want to say that again, voiceless and voteless. So when you go home to your home state, please tell your senator and congressman that something has got to be done, right? But so when we moved to Maryland, we made the mistake of getting interested in politics and active with John Kerry. And I had to be really careful because Senator Brown mentioned the John Birch Society, and my mother wasn't quite that far to the right, but man, was she to the right. So when I took her to doctor's appointments, I had to park the car in such a way that she couldn't see the bumper sticker. Well, that was a challenge, but anyway. My ride with the coalition has been the most exciting thing. But when I have to quote Will Rogers, because back in my museum days, and don't worry, I'm leaving soon. But I actually worked at the Will Rogers Museum out in California for a short period of time, so I've got to quote him. So he said, you have to go out on a limb sometimes because that's where the fruit is. So for me, the fruit has been abundant and delicious, and I thank all of you for that. So I have just one more story. You may notice this pin, Healthcare Get It. So right after the ACA passed, our coalition thought, we got to have something we got to have a logo, honey. We got a way to do it. So we came up with Healthcare Get It. So the first time I wore it, I went to a gas station to pump gas. I'm not expecting anything else to happen to me, of course. And some guy came up to me and said, and you know, I'm 66, so I was like 63 at the time, let me point that out. And so he came up to me and he said, where do I get it? And I thought for like 2 seconds that I looked like my daughters do now, right? And I got very excited, but that passed quickly. And so I said, get what? And he looked at me like I was out of my mind. And he said, get health care. And I thought, oh my God, I have no idea where to send you. Right? Because we had no exchange. What was I going to do with them, right? I did think of something, I just want you to know that. I think I sent him to Medicaid because he looked like he might, be eligible for that. So let me just quote the great philosopher Garrison Keillor, which is germane to what Reagan just said and what Senator Brown said to us today. So you may know that he always closes out with, be good, but I say, please be not too good. And do great work, and please, please stay in touch. We all need you so much. Thank you so much.
And now to our third award, which, as I mentioned before, is new and recognizes our deep commitment to health equity. And so I'd like to invite Cincy and Joe to come up here. There they are. And as many of you know, I think a great many, Cincy at Families is the director of our health equity work, and she does a great job.
Hi, everybody. Thank you so much for being here. I am sorry to have to correct Phil in public, but A few years ago, Families USA decided that we needed to specifically recognize and elevate the work of an advocate dedicated to advancing health equity. So this is actually the fourth year we have it. So starting in 2012, we have presented a Health Equity Advocate of the Year award. And they have gone to both people that have worked at the national level on health policy, advancing health equity, and also at the state level. This year, Families USA recognizes Joe Martinez from Health Action New Mexico. We like to have someone who has worked closely with the awardee to present him. It was going to be my colleague, Lizette Rivera, who had insisted that this year's award had to be Joe. And I had given her different options. We discussed, no. It has to be Joe. But unfortunately, she's under the weather, so she can't be here, and she's very sad about it. Zed had gone to New Mexico and saw firsthand the fantastic work Joe was doing, particularly with Latino and American Indian communities. But instead you have me, and I'm a very poor substitute. So what I'm going to do actually is read what Lizette was planning to say about Joe. In his role as Consumer Outreach Coordinator at Health Action New Mexico, Joe focuses on community outreach and education, building coalitions of advocates, and community empowerment. His passion for equity and community building is a constant inspiration. Not only does he seem to accomplish the impossible by reaching out to voiceless communities, but he inspires the community to sit at the table and be part of the solution. Whether it's assisting tribal communities, knocking on the doors of the uninsured, pushing health literacy as a priority in his state, giving voice to the LGBTQ community, or the encouragement for community leadership, for Joe, challenges are just perfect opportunities to give a voice to the voiceless. His passion for equity is contagious, and his true humility should remind us all why we got into this work to begin with. Suzette said that she asked just yesterday how the ACA has affected him and his life, and he answered, he talked about how it brought him closer to the cultural context of New Mexico communities, allowing him to build bridges amongst various groups who never would have come together otherwise. He talked about how he was able to bring local leaders together so they could stand up not just for themselves, but for their neighbors. This tells us that fighting for health equity and social justice is not just Joe's job, it's who he is. And to make sure, that's what Zed said, and to make sure I did Joe justice, I also asked his staff to tell me a little bit about him as well, and it is very impressive. Joe has the unique ability to connect with people of all backgrounds. People trust him because he is genuine and kind and has everyone's best interest at heart. I think he is a perfect embodiment of the health advocacy community. He wants to translate his deep care for all people into a healthcare system that works for everyone. Clearly, Lizette was absolutely right in pushing for Joe. It's my honor to present Families USA's Health Equity Advocate of the Year to Joe Martinez.
What can I say after that? I mean, you know, very briefly, one of the most important things that a person can discover, that is that there are so many talents in one's community, and that those talents can be collected together under a cause that is going to impact the community's ability to thrive. And I think that one of the most important things that I can share is that in this work, it has been an incredible opportunity to bring together people that want to serve their community, that want to serve their neighbors, that want to serve their families. And in doing that, everybody becomes stronger. And in the act of helping each other, that is a community that is built to thrive into the future. I appreciate so much the opportunity to work in partnership with so many people that want their communities to thrive. And I would say that Families USA has created a community of people committed to make sure that communities all across this country thrive, that they are healthier, that they are active in getting people enrolled, that they are active in using that health care, and more importantly, that together communities are going to be there to defend that this healthcare opportunity is going to be kept safe and sound and flourishing, and that all of us as a community are committed as one community to make sure that every community of the country thrives and that everybody has that opportunity to be able to contribute to the success of their neighbors, of their families. And I think for that, I really appreciate the fact that we do this as a team. We do this as a team. And the future is bright because of the talents and the commitments that are represented here tonight. I so appreciate this. This is a lot of fun to be here, but it is so much a testament of everybody's commitment. We are one community under Families USA, and we're certainly going to see that all of our communities thrive. Thank you.
And now let me turn it over to Patrick, our field director, for a few words before we close tonight's wonderful ceremony. Patrick?
Thank you, Phil.
Ah, there you are.
Thank you all, and thank you for participating in this great ceremony to honor the hard work that some advocates have done, because you know there's so many of you out there that have done great work, and it's good to be able to honor that work tonight. What I have to tell you, though, is, of course, that tomorrow we'll have breakfast at 8:30, and that the opening plenary session will start at 10 o'clock. So what I want you to do is enjoy the awards night, have some fun, pretend it's the Oscars, and we'll see you tomorrow. Thanks so much.